What's going on, everyone? Happy Saturday to everyone. Hopefully everyone is doing well, staying safe, healthy. If you had to take a COVID test, hopefully you have tested negative. If you did test positive, I hope you have a full and speedy recovery with no long COVID issues. It's time now for the Saturday edition of the Pandemic Update for Saturday, July 20th, 2024. If you're new to my channel, this is where we do the daily Pandemic Update. Welcome to my channel. Today, we're going to be talking about several different things, including an update on President Biden, who did test positive for COVID this week. Now, you're probably thinking, COVID? Oh, COVID's over. No, it's not. You just heard me say the president has it, and we are in a major summer wave. How big? Well, stay tuned. We have some new data that says this wave is pretty significant right now. So yes, COVID's still in circulation, and there's other viruses out there. We talk about them as well. We don't just focus on COVID. When there's news about flu, RSV, H5N1, and all these other different viruses, we give that to you as well. So if you're new, hit that subscribe button down below to help stay informed. You want to help push this content out throughout the YouTube algorithm? Give it a thumbs up, share it with anyone you know, and hit that notification bell. The more people that hit that notification bell, they get notified, they watch the video early on, and then YouTube says, hey, people are watching this video. Let's push it out. Let's inform more people about this, which is a good thing because we want to keep people safe and informed with what's going on. And remember, leave your comments down below. Alrighty, today we are going to start off with today's update from the president's physician, Kevin O'Connor, on President Biden. We're going to read most of this, and you're going to see here, there's going to be something at the end that doesn't quite make much sense to me. Maybe you could make sense of it, but I'll show you why it doesn't make sense. Let's just read on. President Biden completed his 6th dose of Paxlovid this morning. He is still experiencing a loose, non-productive cough and hoarseness, but his symptoms continue to improve steadily. His pulse, blood pressure, respiratory rate, and temperature remain absolutely normal. His oxygen saturation continues to be excellent on room air. His lungs remain clear. Now it gets a little interesting. Genomic sequencing has determined that the SARS-CoV-2 COVID-19 variant, which the president has encountered, is the KP.2.3 variant. According to the Centers for Disease Control and Prevention, CDC, the KP.2.3 variant accounts for approximately 33.3% of new infections in the United States. Does that make any sense to you? Let me explain, and then we'll get back to reading this. They just said that makes up 33.3% of new cases. Well, I had to tweet about that. And take a look at this. I tweeted out, the latest variants. We show this, the CDC Nowcasting page. And, well, we're not seeing the KP.2.3 variant as 33.3%. I'm seeing it at 12.8%, but, this is the White House. They have access to things that we don't have access to, but the public has access to this, and the public sees 12.8% is the KP.2.3 variant. So, I don't know. And it's not 33% at this time. One that is close to that would be KP.3 at 32.9%. Alright, reading on. The president continues to tolerate treatment well and will continue Paxlovid as planned. He continues to perform all of the duties, his presidential duties. And it says he will continue to keep your office updated. This is the physician will continue to keep the office updated with any changes in his condition or treatment plan. Alrighty, moving on now. CDC reports another human case of H5N1 bird flu in Colorado, taking the total at a poultry farm in Colorado to 6. So that number continues to rise in Colorado at this time. Italy, COVID update, weekly COVID update in Italy. They saw 8,940 new COVID cases. That is a 61% increase from last week, 61% higher than last week, 133% higher than 2 weeks ago. Take a look at this. Here it is on the chart. Italy is absolutely skyrocketing right now. 40 deaths this week, 21% higher than last week, 122% higher than 2 weeks ago, the worst figure of the last 6 months. So even deaths are rising there. 1,183 COVID patients in the hospitals. That's an 18% increase from last week, 39% increase from 2 weeks ago. The worst figure of at least the last 6 months. Not good. And 43 COVID patients are in the ICU. Again, worst figure of at least the last 6 months. The COVID positivity rate is 11.2%, 56% higher than last week, 138% higher than 2 weeks ago, the worst figure of the last 2 months. All data uh, here basically says it is continuing to go higher in Italy at this time. Europe COVID cases have increased fivefold in 8 weeks. COVID hospital admissions are 51% higher than in the previous 4 weeks. COVID deaths are 32% higher than in the previous 4 weeks. This is in Europe. You just saw Italy. Yeah, it just goes to show you our data here in the United States is not all that great. We're not doing a great job of keeping track of hospitalizations. You have to think the numbers in the hospitals are higher than what we know about. It could be a little, it could be a lot, but at the very minimal, they have got to be higher than what we know about here in the United States. So, yes, this is not a good trend going on around the world. Now, taking a look at the latest update from Jay Weiland, and we can see here that on July 19th, he put another substantial increase this week. This is for COVID. 26% increase. Yeah, that's not good. Wastewater signal now higher than last summer's peak and over a month earlier. So, yes, we have now gone higher. You can see last summer's peak was 711,396. We're now at 780,059. And take a look here. It's continuing to go straight up. Will we hit 800,000? Yes. Will we hit 1 million cases being detected a day in wastewater? I hope it doesn't get to that, but you can clearly see here that the levels continue to rise. And it's happening earlier this year, but despite that, we have gone higher than last year at this time. Reading on, 780,000 new infections per day. 1 in every 43 people currently infected. Remember, there's several different people that do modeling and estimates. Sometimes they come up with different numbers. 45% higher than the 12-month average, but he did put more. The ratio of people currently infected by region. Midwest, 1 in 59. The South, 1 in 34. The Northeast, 1 in 73. And the West Coast is now 1 in 25. Rising in all 4 of these regions. He expects a peak in the next couple of weeks. Nationally, regionally, I think the West and South are closer to peak than the Northeast and the Midwest, and I would agree with that. I think the Northeast and the Midwest are going to be the last places to peak because, well, the wave actually started up here quite a bit later. So if I had to guess personally, coming from me, the Northeast and the Midwest probably looking at maybe another month until the peak, but I would have to think the West within a couple weeks, yes, is definitely going to peak. And then he put another reminder that deaths and hospitalizations are far lower than they were years back. Despite high case counts, long COVID persists as a risk, but the acute risk have decreased by 20-fold since 2020 and 2021. I mean, yes, hospitalizations are lower, but again, we have to remember we're not reporting as much. Even at that, yes, they are definitely lower, but I would love to know what the real number of hospitalizations are right now because I'm seeing so many social media postings of people in the hospital, some being um, people that are on TV and different things, high profile, that are in the hospital for various different reasons. They're not specifying the reasons, but yes, it's not a good thing to see a whole number of people saying, oh, the hospital's very busy right now. And I'll show you emergency department visits in just a little bit, and I'll also show you Philadelphia's EMS calls, which here in Philadelphia, they're not dropping despite the cooler weather, which is not a good sign. National allergy map today. 43% of the country is in low to medium status. When we take a look at air qualities, let's refresh this. We can see, yes, there are some problematic areas with air qualities. Not terrible in the east today, but on the west coast it is bad. And we're actually going to go a step further with the west coast today, and I want to show you this. This is coming from the National Weather Service in Boise, Idaho. It says smoky and hot. Here are the current wildfires along with forecast smoke. So you can see here on the west coast, here's Northern California down here, here's Oregon, here's Seattle, Washington, here's Idaho. Yeah, look at this. The smoke. It's going to be remaining thick. It's actually going to spread towards the Seattle area over the next several days or the next 24 to 48 hours, and that is going to reduce your air quality. And when we take a look at current air qualities, we can see it has not reached Seattle yet, but look what's to your southeast. That is actually going to be spread back to the northwest, which that can be problematic. And if you have to go outside in any of these areas where the wildfires are ongoing or the smoke comes into play, please be careful, because it's not good for your breathing. If you have breathing difficulties already, like COPD or asthma, you might just want to stay indoors and leave them air purifiers running. Heat-related illnesses, they are still increasing in many places, but I think we are going to see a little bit of a break going forward because it is not as hot now. Taking a look at this, yes, I do have another place where I talk about climate and weather. That is Climate Data Report over on X, and I also do have another channel called Climate Data Report as well. All right, moving on. Philadelphia. Another 839 EMS incidents yesterday. It was very busy. It wasn't even as hot. The humidity is down here. It is just really busy right now, and I question how much are we really testing for COVID? Because when I listen in, and I do from time to time, I hear so many calls that say sick with breathing difficulties or fever. Are they testing for COVID or not? I really don't know. Because when you take a look at Philadelphia's numbers, which we can do, let's briefly take a look at that. The numbers here. I mean, look at this. You mean tell me in a city that's around 1.6 million people, there's only 3 hospital admissions back in on June 23rd. Mind you, that's fairly old data. It's not updated, but again, there were only 3 hospital admissions. With all these calls that I hear about, I don't know. I find it very hard to believe. Alive looking right now at Montgomery County, Pennsylvania, and we do see there are quite a few calls, 15 calls to be exact. Respiratory emergency, dizziness, diabetic emergency, stroke, fall victims, head injuries, all kinds of different things. Hopefully less busy in Chester County, but nope, it's not. We do see sick person, respiratory difficulty, unconscious person, hemorrhaging, injured person. Sick person has been showing up a lot. At one point this morning, there were 4 at once, and it's just constantly always there now. I mean, we do note in Pennsylvania, I have showed you this, there are large increases right now being detected in Chester County, Pennsylvania. All right, moving on. Walgreens this week. This week at Walgreens, the positivity rate was 39.2%, down because testing went up. Moving on now, we want to take a look at emergency department visits for people diagnosed with COVID. This is something we've been doing on Saturdays as of lately. Now, as we go along here, we may make 1 or 2 little detours along the way. So, starting off here with the United States, we can see nationwide, people diagnosed with COVID showing up at the emergency room. Yes, it's continuing to go up. It did not go up as fast this week, but it is still rising. Alabama is rising, and it's leveled off a little bit. Alaska was rising rapidly, then it slowed down and dropped a little bit. And then Alaska, well, it went back up once again. Arizona continues to rise at this time, but if we look, in the last few days, looks like it's leveled off a little bit. Arkansas is still rising. California is still rising, but take a look. If you look real close, California could be showing signs of a peak soon. Hopefully that is the case. Colorado is rising. Connecticut is rising at this time. Delaware is rising. D.C. was rising, now has slowed off a little bit. And Florida is just absolutely, they have been skyrocketing. Maybe some signs of slowing a little bit, but take a look at this. I mean, this is really not good. You're higher now than what you saw back in the winter. And if we take a little detour here to some wastewater data in Florida. I wanted to show you South Orange County, Florida, and I want to show you this in detail. And we are going to actually zoom this out if we can. We're going to zoom this out to all available time from Wastewater Scan. In other words, going back to when Wastewater Scan first took on this wastewater site. And take a look here. What do you see? This is the highest COVID level that has ever been reported at this wastewater facility. So, I mean, if you're going to Disney right now, or Orlando in general, if you're going to south portion of Orlando for any reason right now, please note this is the highest Wastewater Scan has ever reported for COVID levels, passing last winter's wave, the summer wave. I mean, this is the highest it's ever been there. This is really dangerous at this time, so please take this seriously. All right, moving on. Georgia, yours rising as well, slowed off a little bit. Guam is dropping at this time, but then we come to Hawaii. Hawaii at this time is dropping, and that's where we come to our next detour. Looks like Hawaii has reported 937 cases in the past week, and their total number of deaths for the pandemic in Hawaii is 2,199 at this time. So again, that is 937 cases. It looks like the 7-day average is 135, which is dropping. And it also looks like the positivity rate is 16.3% at this time. And trying to find hospitalizations, I'm sure it's here. But you know what? We're actually just going to go back to the emergency department visits because we want to get every state included in this. Idaho has rose a little bit. It's slowing off a little bit. Illinois continues to rise. Indiana, Iowa, all rising. Kansas is rising. Kentucky continues to rise. Louisiana is really picking up the pace here and rapidly rising at this time. Maine, good news. Maine has actually dropped a little bit, but I have noted in the past, sometimes Maine starts to rise at a different time. Sometimes it goes right down to the individual state, and we have seen in the past where Maine sometimes goes up in September. We'll have to see if that's actually the case. Maryland at this time is going up. It slowed off a little bit. Massachusetts was rising, leveled off a little bit. Michigan continues to rise. Mississippi, Montana continuing to rise. Nebraska, Nevada continuing to rise. New Hampshire was rising. Now they're dropping a little bit. New Jersey continues to rise at this time. New Mexico dropped a little bit, but then they started to rise once again. New York State showing some signs of slowing off here. We'll have to see if that actually holds true. Again, these are people diagnosed with COVID showing up at the emergency department. North Carolina rising at this time. North Dakota not rising too fast, but kind of dropping a little bit now. Ohio continues to rise. Oregon dropping a little bit now. Pennsylvania, my state, is starting to pick up the pace. I think that will continue. You see, wastewater sites are starting to rise. Rhode Island is dropping at this time. South Carolina, look at this. Almost going straight upward. South Dakota dropped a little, then rose a little again. Tennessee is rising. Texas is skyrocketing at this time. Not good at all in Texas. Utah still rising. Vermont is actually dropping a little bit. Virginia continues to rise. Washington dropping a little bit. And West Virginia is dropping a little bit as well. All right, taking a look now at what's going on with emergency department visits in general. And you can see Pennsylvania, substantial increase. Texas, substantial increase. Why? Well, you saw the chart there. It's rapidly going upward. Louisiana, Arkansas, there's still a lot of places that are substantial or moderately increasing. Very few are actually dropping at this time. It's dropping in Vermont, Rhode Island, South Dakota, and Wyoming at this time. Epidemic status. It's growing or likely growing in the majority of the states. Only a very few states are stable or uncertain, and we don't see anywhere saying likely declining. If we did, I would have to guess that would maybe be Hawaii at this time, considering that they are dropping. New Jersey today, if we can see anything from New Jersey, because this page is coming up blank at this time, but New Jersey did remain about status quo, maybe just a slight increase for hospitalizations. 385 people in the hospital at this time, and New York State does not update on the weekends. We did not get an update yesterday, so can't talk about New York State till hopefully again on Monday. Alrighty, folks, that does it for the Saturday edition of the Pandemic Update. If you were just informed that COVID's not over and that, hey, we are now higher than last summer's surge, give this a thumbs up and subscribe down below, because I'm really the only one that is doing this daily still, and you need to be informed with what's going on. Share these videos with anyone you know. Hit that notification bell and leave your comments down below. I will see you all again tomorrow for the Sunday edition of the Pandemic Update, where we will focus on wastewater. Until I see you again next time, stay safe everyone, and have a fantastic Saturday afternoon. Thanks for watching.